work together on cultural, economic, and business development. And this is another example of the relationship and the friendship that exists within our city. We all know that at the start of the COVID-19 health crisis, Asian businesses were hit hard by rumors and therefore lost a lot of customers and revenue. But despite all of that, they have stepped up again to help out their Houston and the Houston people in the region, and I certainly want to thank them. Despite some business losses and other challenges faced as a result of COVID-19, they never lost faith and continue to give back to the greater Houston community. The donations we are accepting today includes 10,000 masks, 40 gallons of sanitizers, 825 isolation gowns, 270 goggles, 500 facial shields, 250 boot covers, 3,600 gloves. And I want to thank everyone involved as contributing partners. Yeah, you can give it up to them. And if I could speak for Ben, I know he will be up here later. Ben has indicated to me that also more on the way. So thank you so very much, Ben. I want to thank everyone involved as contributing partners in the Together Houston is Stronger campaign, the Houston Tsinghua Alumni Association, the Sino Professionals Association, the J.J. Clements Volunteer Team, and the following are partners who have committed towards the future of this campaign: the Chinese Civic Center, the Houston Beijing University Alumni Association, the George H.W. Bush Foundation, China Coronavirus Action Network, the Houston Chinese Association, the Chinese Association of Professionals in Science and Technology. And again, let me thank you in a moment when everybody across our country are looking for needed and vital supplies. I certainly want to thank the Asian Chamber of Commerce for stepping up and helping us out. Now let me yield now to Ben Yu, the chairman of the Asian Chamber of Commerce. Ben.
Thank you, dear Mayor. Good afternoon. Back to the January and February. By the way, my name is Bing Yu. I'm the chair of the Asian Chamber of Commerce. And back to the January and February, when Chinatown and Asian business were hit by 70% due to rumors. At that time, Mayor Turner and County Judge Hidalgo and many organizations and individuals came to Chinatown and saved our business. Now, when ourselves were hit by coronavirus, and we need to step up and support our city. Our campaign is Together, Houston is Stronger. We as a collective body, including Chinese American, Indian American, Korean American, Vietnamese American, Japanese American, Filipino Americans, and various others, AAPI, ethnicities, are in support of helping Houston through this challenge crisis, and will stand by Mayor Turner and the city of Houston in whatever needs are in the future. Thank you so much. Now I want to have our Vice Chair, Kenneth, to have some few words.
Thank you, Bing. Honorable Mayor Turner. Well, I think I just want to thank all the volunteers and all the contribution and then from the Asian Chamber of Commerce and our community. Asian American, especially the Chinese community, has been in Houston, for a long time, and we are part of a Houstonian. And this is a time for us to show our appreciation and also show that we are part of Houston. We want to make these small donations, and hopefully that more and more people come to support our city, support the whole Houston during this difficult time. I want to thank you, every one of you. Thank you.
Thank you, Kenneth. I also want to acknowledge Mayor Pro Tem Dave Martin, who's also President, and State Representative Jean Wu, who's also here with us today as well. Look, this is an important time. It's a critical moment in time, and it takes all of us working together in order to get past and through this challenge, this crisis. And so I certainly want to thank the Asian Chamber of Commerce for their generous contribution. Now, at this point in time, I'll pause and take any questions anyone may have. Oh, and let me acknowledge Congresswoman Sheila Jackson Lee. Looked over and saw her. Thank you, Congresswoman. Yes, ma'am.
First question, how will the supplies be divided and how long do you expect them to last?
Dr. Purse, you want to come up and take that question?
Thank you for the question. So the supplies have been given to the city, and so our primary two groups, or actually three groups that are consuming these supplies are the fire department, the police department, and the health department. And so we're going to be looking at where the needs are most, because each of those departments has had some stock that was in supply that we're consuming at an increased rate than usual. And so we're going to try to level that playing field that matches the consumption as we move forward. And then we're simultaneously hoping and anticipating the federal government will be able to backfill with more supplies, as time goes on.
Question for the mayor on this one. Mayor, our
Yes.
reporting indicates that the county is crafting some form of a shelter-in-place order at the moment. Are you supportive of that directive at the moment?
Well, I think the county, they're meeting, and I think we're all working on what the next steps will be or should be. And I know the county judge and we've had conversation earlier today. We'll have additional conversations before the day is out. But we're all thinking through what the next steps should be. I don't want to get bogged down in terminology, but that process is on the way.
Mayor, can you specify a little
Sure.
bit more? Because I know there's a lot of people, and you've been getting a lot of messages where people say, look, we need some sort of shelter in place or stay-at-home ordinance. If something were to be crafted regionally on this, I would assume it would be something that you and the judge and various other entities would agree on. What kind of form do you expect that to take? I mean, are you going to be at some point telling people, hey, we've got to close up more businesses or less? I think people are really, they want to kind of have a better idea of the sort of the definition of stay-at-home or definition of shelter-in-place if and when we were supposed to have it.
Yeah, I think we need to be very careful in just using the terminology. I think a better way of putting it is what are the goals and objectives that we are seeking to achieve. I think that's the starting point. What are we seeking to achieve? And the goal, the universal goal, whether you're talking New York, California, Washington, Illinois, state of Texas, and other places, is to take the necessary steps to blunt the progression of this virus such that our healthcare delivery system is not overwhelmed. That is the overall objective. Okay. Now, you can call it you can use many labels, but the question is how to achieve that. Already, for example, in the Houston area, when it comes to restaurants, bars, and clubs, we've already addressed that. By and large, when you come to gyms, cinemas, theaters, we've addressed that. There are no sporting events. There are no cultural arts events that are taking place. Schools are closed. That's on the elementary, secondary, and higher ed. They are closed. So when you look at what is already there are no large gatherings. We have reduced that group to about 10 or less. That's already in effect and taking place. Even for the city of Houston, we have reduced the number of employees that have to come to their station. If they can do their jobs from at home, they're working remotely. For many of the businesses that are in the city of Houston, for example, if you're talking about NRG, AT&T, and others, they are reduced to pretty much their essential personnel, and many of them are working remotely. So that's what you have already. When you look at the orders that exist in California, New York, and some of these other places, what is functioning taking place in the city of Houston and our region, in large part mirrors what they have ordered. If you look at the order that the county judge in Dallas put in place, it speaks about sheltering in place. Then there's a laundry list of exceptions, a laundry list, including liquor stores. Okay? And so the question then becomes, what is it that we are trying to achieve, and how do we do it in such a way that we are being truthful and transparent with the people that are looking to us for guidance and direction? So that's where we are, what the next step should be. I think we're all thinking through that process as to what the next direction should be. But it's not something where you're putting forth a placebo and then there's a laundry list of exceptions. So everyone is working on that. What I would tell people right now, social distancing is important. We have already reduced the number of employees, for example, that are going to businesses, and they ought to be working remotely from at home. And there is no order, for example, that are telling people you just can't leave your house. Okay? If you look at all of them, it doesn't exist. If you look at a place like California, and so all of the people that are on the beaches in California, look at the places in New York and see what's happening there. So it is important that we speak with as much clarity as possible, that we are as honest with people, and that people have to be responsible as well. So we're working through that, and that's a message that we're all trying to craft, not just in the Houston-Harris County region, but quite frankly with other counties and cities throughout the state. And we're all talking with one another in real time.
And can you just follow up on that? Can you talk a little bit about the tension that we see out in the community? You go to Memorial Park right now, lots of people out there. Every single person we talk to out there is saying, this is fine, let's just keep this, no lockdown. And then if you are online, you talk to people who are home, they're saying what we have done is not enough. Can you talk a little bit about trying to balance these two sides?
And that's what you're trying to balance your health care objectives, because you don't want to overwhelm your medical center, medical delivery system. So you want to blunt the progression. I mean, that is the goal, to blunt the progression. And in order to blunt the progression, of course, it comes into social distancing and all of the other things that we are asking people to do: sanitize, wash your hands, avoid large groups, all of that. On the other side is the economic balance. Because the reality is that you don't want to do something, for example, that just that's a total economic shutdown, and then people are in their livelihoods totally disrupted, and that can be, in some cases, for many people, can be worse than the virus itself. So what we're all trying to do is strike that balance, okay? And even if you tell people, okay, to stay at home, you're working remotely, stay at home. The other question then becomes is the enforcement piece, okay? And so in all of the orders, they're not telling people not to go to the parks, but if people are going to the parks, they ought to practice social distancing. If you're going to the parks and you're within arm's length of a person in front of you or behind you, then you're way too close, okay? If you're in the park and you're not engaging in social distancing, then you're not meeting the request that people are making on you. If, for example, if you're not, clubs, bars are shut down, but if you're holding private parties in your home and there are more than 10 people in your home, then you are not practicing what we are asking you to do, okay? All of those things are critically important. So what we are trying to do is to let people, number one, to emphasize this is important. This is serious, and we all need to take it serious, okay? But when you look at what we have already done in the city of Houston and take a look at what the orders in some of these other cities or some of these other states, I think you will see, functionally speaking, we are doing most of those things, but what we are all considering, I know the county judge, myself, other county judges and mayors in other parts of the state are saying, what's the next step and what do we need to do? And we're all thinking through that process. That's a long answer, Maya, to your question.
Sure. For law enforcement officers who are not able to quarantine at home due to possible exposure to the coronavirus, why is there no dedicated quarantine location for them to go to?
Well, that's not true. Just like the 4 firefighters the other night, they were placed in a hotel and quarantined. And then the city has also been working with 2 other hotels in the city of Houston to lease those hotels specifically for first responders and others who cannot self-quarantine at their home. These events have happened rapidly, and the city has been in negotiation, for example, with hotel owners to lease those hotels, and I would tell you approximately about 180 rooms that we are looking at leasing, and those deals probably should be consummated before the week is out.
So it's currently enacted that the law enforcement officers can go to those hotels?
Yes, I myself, the other night, when the word came that they needed to be quarantined and they could not go home, I gave the order. We need to work together. And if you can recall, when we started out with testing, who were the first people for testing for the city of Houston? First responders and healthcare providers.
Mayor,
Yes,
regarding
yes,
the Dallas County order, it sounds like you're kind of saying that you potentially agree with some parts of that order, but you just want to avoid issuing some order that would confuse people because of the label or because of the name itself. Is that kind of what you're getting
Yeah,
at?
what I'm saying is that I think it's important for whatever we put forth to people that is how can I put it? It speaks with clarity and with integrity. And what I mean by that is that when I listened to the county judge news conference and I read the order, and it speaks about a shelter in place, but then there's a laundry list of exceptions. I mean, please take a look at the order. And when you start accepting out liquor stores and everything else, then at the end of the day, it's like, okay, it's shelter in place, but there's this whole laundry list. You don't want it to be more confusing, and what you put in place, you want it to be enforceable. I mean, that's important. I will say that with what we have done in the city of Houston, when we've postponed, for example, any and all city permitted, produced, sponsored events through the end of April, we've already done that. All schools in our area are now closed. That's done. All cultural arts events have been either canceled or rescheduled. Conferences, conventions, gone in the city of Houston. Gyms, theaters, things like that closed. Restaurant, bars, nightclubs, with the exception of takeout or delivery. That's done. So it's important for us to make sure we have compliance on all of those additional measures. And now what we are taking a look at in candor is what additional things can we put in place that can also further the goal of blunting the progression of this virus. What additional things can we do? Instead of some sort of blanket assessment or order, but what additional things that we can do that are strategic and achieve the same objectives and speaks with clarity. But we're working through that. We're thinking through the process and what the next steps will be, and I suspect within the next 24 hours or something, we'll probably work these things out. But it's not just just here locally. There are conversations taking place with other cities and county judges as well. Okay? Okay.
Dr. I just wanted you to, if you don't mind, clarifying for us. I think there's still some confusion among viewers about all the testing sites, who operates them. Can you just give us a general overview in the Houston, Harris County area? How many testing sites are there? How much each testing site can test up to, and how? And I guess for some people, and what candidates are best for these testing sites? Because some people who have access to you should encourage them to go to, I guess, their private doctor.
Right.
They have private insurance.
Yeah.
Kind of clarify some of those things for us.
Sure. Before I do that, I want to recognize Ms. Illy Jaffer, who is a member of our health department team. She's also a member of the board of directors for the Asian Chamber of Commerce, and she was integral not only in having this meeting, but in getting these donations. So we really need to thank her and her efforts. And so to your question, you're right. There is obviously opportunity for some confusion about the testing sites because I'd like to think of it in two ways. There are the public ones, which are currently the ones that the city and the county have stood up with the support of the federal government. And then there are a number of what we'll call private ones. For example, the one at United Memorial Medical Center on Tidwell, which has gotten a lot of media attention. And there are others beyond that. They just haven't gone after the media attention because they're concerned about how much flow they get. They want to make sure they can manage the flow. So there are actually many. With the ones that are supported by the federal government, the three that are up now, the two by Harris County and the one at Butler Stadium by the city, and we do have plans for yet a fourth one with the city once the volume of testing would require that. They have a testing capacity limit, if you will, of 250 samples per day, and that's set by the federal government because there are approximately, last I heard, there are probably 40 of these centers across the nation. They're using a commercial lab, and at 250 per site per day, that will max out the commercial lab. So that's why it's been limited to 250 per day. At the private sites, which are using different labs, some private labs, some commercial labs, their capacity, their limit is going to be different based on the relationship they have with the laboratory and or their ability to get people onto their property and to manage the crowds. And so there is going to be differences in those, and I apologize for that confusion. But the goal is to make testing available to the appropriate persons, as widely as possible. And so that goes to the second part of your question of who should be tested and who shouldn't. In a perfect world, we would have just unlimited amount of testing, and anyone and everyone could be tested, and that would be useful because then everybody who is infected, we would be able to identify and then have that person basically isolate themselves and make sure they didn't spread it to anyone else. In the absence of having that much testing capacity, we need to prioritize and focus on those individuals who are most likely to spread the virus most widely. So there are, and you have seen this in the media reports already, there are persons who have been tested who were asymptomatic, members of the federal government, for example, and some celebrities who did not have symptoms and tested positive. And we have been saying that if you are asymptomatic and you get tested, you may get a false negative. Not that you will, but that you may get a false negative. Conversely, people who are asymptomatic may actually test positive. But the reason we're trying to focus on the people who have symptoms is that your ability to spread the virus parallels how much symptoms you have. So somebody who's asymptomatic may be able to be tested and found positive, but they're not likely shedding a lot of virus to the people closest to them because they're not having symptoms. Whereas somebody who's symptomatic, predominantly with a cough, they probably have more virus, well, they certainly have more virus in their body at that time, and because they're actively coughing, they're spreading it to a much greater extent. So between the two, who would we want to identify? The people who are spreading it a little bit or the people who are spreading it a lot? It's the people who are spreading it a lot. That's who we want to identify and then make sure that they isolate to minimize it. So does that leave a gap? It sure does, but that's because we don't have a ubiquitous amount of testing available. Does that answer your question? Right, so the county announced that they're going to have a new web portal for entry into their system, and so they just turned that on this morning. We're going to be, watching, because it's, like any other computer system, we want to make sure that it can handle the volume, right? And so they're starting it off, and if they don't have any glitches today, we don't expect it, but I think being prudent, we're going to give them the chance to make sure that everything works the way they expect it to, and then our folks, we're going to work with our folks to merge them, because we would rather have a single portal for the public to lessen any confusion. But it's really allowing them to walk before we run together. Okay, thank you.
Okay, again, let me thank the Asian Chamber of Commerce. Certainly appreciate the donation. Let me just say, if there are others out there who have supplies that they also want to donate, we certainly would appreciate all of that. And then we'll continue to work through the necessary steps to keep people safe within the city of Houston. Again, let me encourage everyone, social distancing, social distancing. That's the main thing. To those people who are, for example, in our parks and other places, same thing, social distancing, and avoid just large groups and crowds. That's the best way you can help us. Even if, for example, you're at home, you're working remotely from home, you still need to practice that when you're leaving your home and you're outside. That's the important thing. All right. Thank you so very, very much. Appreciate you. Thank you, council members. Thank you, Councilman.
Well, if there's one thing that's clear after listening to Mayor Sylvester Turner and earlier today, County Judge Lena Hidalgo, it's that they are both reluctant to issue a shelter-in-place order for Harris County or the city of Houston. They don't even like the term, and the mayor pointing out during this press conference that he says the city has done much of what California and New York and other states have already done with everything that's closed and all of the orders that have been put in place. But he also pointed out, what good is it to tell people to stay at home when you can't enforce that, and there's not that piece there. He's trying to strike a balance, he says, while taking this very seriously, not issuing orders and telling people to do something they either won't do or can't be forced to do here in the city of Houston. But very clear, both are reluctant to issue that order, as Dallas County has done. The mayor even pointing out that even though Dallas County has done that, there is a long list of exceptions to who has to stay at home and what's closed, and that includes liquor stores in Dallas County. So the mayor made that point twice during this short press conference, talking about the reasoning behind what the city is doing and what the city is not doing. The other new information we got today, I think, is this city testing site. We heard from Dr. David Pers that the reason that they've capped the test to 250 a day at these 3 sites, 2 in the county, 1 in the city, is not the supplies needed for the tests that have been supplied by the federal government, but the testing capacity of the lab that's doing all these tests and processing them all around the country. Apparently 250 a day on each site is all they are able to do, and that is why the city and the county are not doing more than that at these sites each day. They can't be processed any more quickly than that. So that's what's going on there. The mayor also don't want to overlook, he was thanking the Asian Chamber of Commerce for donating $42,000 worth of medical supplies, mostly masks, 10,000 of them, and a laundry list of other things. Since they were donated to the city, they will go to the police, fire, and health department and be dispersed to those departments as needed, as our first responders are using up those supplies during this epidemic. So that is the latest from the city of Houston. We are waiting at some point later today. We expect we could hear again from the county judge, Lina Hidalgo. We know the president will be holding his daily press conference. That's scheduled for 4:30 local time, about 3 hours from now. We will carry that live here on KHOU for you. And of course, our news will start at 4 o'clock. That's the 411. We will break in again if anything happens in between now and then on the TV side. You can always stay up to date on our website and by downloading the KHOU mobile app. That's a great way to stay in touch. Turn on those push alerts. We will let you know right to your phone as any breaking news happens, as any press conference is about to start, so you don't miss any of it. You can tune in live or not, depending on what you want to do, but we'll give you that opportunity if you download the app and also turn on your push notifications. That'll do it for now. We'll get back to regular programming. I'm Russ Lewis. We'll see you on the 411 coming up today at 4 o'clock.
If you're new to Medicare, because you're turning 65 or recently retired, you can still get affordable and complete coverage with a Cigna Medicare Advantage plan and get treated like more than just a number, because Cigna treats you like a whole person, body and mind. Get more coverage for less. Call 1-866-606-7599. With Cigna, you get medical, dental, vision, and prescriptions in one plan. A team of doctors for your overall health and healthy living programs to save you money. Plus, no monthly premium and no primary doctor copay. If you're new to Medicare, you can still get affordable coverage for the whole you from Cigna, no matter your health status. Don't wait. Call now to get your free